One of the problems with prediabetes is individuals who have this have no symptoms. So unless you or your healthcare provider go the extra mile to identify it, it can be easily missed.
This is the Transformational Life Consulting Podcast with Deepa Grandin, MD, where Christians like you get the practical support and tools you need to build your spiritual, mental, and physical well-being, and to guide you on your journey to health and wholeness based on evidence-based science and God's Word. I am your host, Dr. Deepa Grandin.
The title for today's podcast is Prediabetes, the Silent Death Trap. What exactly is prediabetes? The World Health Organization has defined prediabetes as a state of intermediate hyperglycemia. And what that means is the blood sugar levels are not in the normal range and they're not in the diabetes range either. It's in between. How do you know if somebody has prediabetes? There's two specific tests that can be done to help determine that. One is checking for the blood sugar level in the fasting state. If it happens to be between 110 to 125 milligrams per deciliter, this is considered prediabetic or impaired glucose tolerance, also called IGT. Another important test is called your 2-hour plasma glucose, which is a test that's done after ingesting 75 grams of oral glucose. And if the level is between 140 to 200 milligrams per deciliter, that's considered prediabetes. The American Diabetes Association has also included hemoglobin A1C, so anywhere from 5.7 to 6.4% is also considered to be the prediabetic range. So what causes prediabetes? The exact cause is not known, but what we do know is a combination of genetics, environmental factors. They are definitely key players in someone having the risk of developing prediabetes. Prediabetes, like type 2 diabetes, is a metabolic condition. What do I mean by that? The individual is unable to utilize insulin properly, so the body either resists how insulin works, or they're not making enough through their pancreas. So when you're defining insulin resistance, it's basically just saying the body is unable to utilize insulin properly, whether you're being given insulin externally or even the insulin your body is making on its own. Now, there have been several mechanisms that have been proposed to why some individuals develop this type of resistance. One is a genetic abnormality of the proteins that are involved in how your insulin acts in the body. Second is fetal malnutrition, which we can understand could be a protective mechanism. And the third is actually the opposite, where you have too much fat in your body, and that causes insulin resistance. One of the problems with prediabetes is individuals who have this have no symptoms. So unless you or your healthcare provider go the extra mile to identify it, it can be easily missed. Now, there is a role for ethnicity. South Asians, especially from India, Bangladesh, Pakistan, Sri Lanka, and even countries like the Philippines and Chinese, they are at much higher risk compared to other ethnic groups to developing prediabetes. So if you belong to these ethnic groups, it's really a good idea to get screened once past the age of 35. In fact, there were 2 recent studies on Asian Indians that reported this ethnic group had the highest global rates of prediabetes progression to type 2 diabetes. To give you an example, I'm Indian. 3 years ago, while training for a marathon, I increased my intake of carbohydrates. Unfortunately, doing this caused my blood sugar levels to spike, and I became pre-diabetic. And this was in spite me training for a long distance run and having a BMI of 20. But thanks to my fabulous lifestyle medicine physician who started me on metformin, my habits of being healthy on a day-to-day basis in conjunction with the metformin did help me get out of the pre-diabetic range. So that's why I love to promote lifestyle changes. Now, there have been several studies done in South Asians that have shown that a combination of lifestyle modification and metformin to be very useful. It's quite unfortunate, though, that most physicians do not screen or treat for prediabetes. In fact, I have several clients who come to me with really high blood sugar levels or their hemoglobin A1C is in the prediabetes range, and they've often been advised by their treating physician, oh, let's just wait and see what happens. Unfortunately, this is terrible advice. The American Diabetes Association has recommended that an intensive diet and physical activity program should be recommended for all patients with prediabetes. In addition, metformin should be added for those with other risk factors, such as having a body mass index of 35 kilograms per meter square, or if you're less than 60 years of age, or if you've had gestational diabetes, that is having diabetes when you're pregnant, or if you were like me, that in spite of doing all your lifestyle changes, your hemoglobin A1C keeps rising. In an earlier study that was performed in India called the Indian Diabetes Prevention Program, they looked at 531 individuals and they split them into three groups. One group did very intense lifestyle changes. One group did just metformin, and one group did a combination of lifestyle changes plus metformin. So the two groups, the one that did just intense lifestyle changes and the ones that did lifestyle changes plus metformin, had the best outcome in that they were able to get out of the prediabetes stage. The ones that just did metformin did not perform as well. Again, pointing to the power of lifestyle changes and the importance of it. Another epidemiologic study, which was a 10-year follow-up of a study called CURES, the full form is the Chennai Urban Rural Epidemiology Study, led by Dr. Anjana. It reported that the progression from prediabetes to type 2 diabetes was 78.9 per 1,000 person years. Now, that is the second highest rate globally. The ethnic group that has the highest rate are the Pima Indians, and theirs were 87.3 per 1,000 person years. Now, all of this is way higher than what is observed in Caucasians, which is around 35 to 40 per 1,000 person years. And it's worth mentioning, even looking at Asian Indians who have normal glucose levels. Now, their progression to type 2 diabetes was very low, was only 22.2 per 1,000 person years. So this goes to show that having prediabetes points to a significant risk that the metabolism has a genetic predisposition to work abnormally, and these individuals need to be way more careful. So why is prediabetes so dangerous? The reason prediabetes is dangerous, besides not having any symptoms, is it can kill individuals through heart attacks, heart failure, stroke, and what we call all-cause mortality, meaning it increases the rate of death. And this happens even before your sugar levels enter the diabetic range. Pre-diabetics have a lot of fat deposition, even in the very large blood vessels. And a lot of times people with prediabetes also have something called metabolic syndrome, where there is obesity, high blood pressure, high triglycerides, insulin resistance. And all of these contribute to increased fat deposition in blood vessels. And this is what promotes heart attacks and strokes. And to top it off, people who have prediabetes also tend to be very inflamed with high fibrinogen, C-reactor protein. All of these also contribute to increased fat deposition in blood vessels, which contribute to the dangerous heart attacks and strokes. So what can you do? What can you do on a day-to-day basis to prevent your prediabetes from hurting you or even progressing into full-on diabetes? By far, the combination of diet and exercise has been shown to be the most critical factor that can halt the progression towards full-on diabetes. Let's discuss some dietary guidelines, okay? So we all know that refined sugar, refined flour is terrible for us. So what should we be eating? It's good to include a lot more non-starchy vegetables, such as broccoli, spinach, and green beans. Definitely want to get rid of the refined sugars, refined grains, anything like white bread, white rice, white pasta, which has less than 2 grams of fiber per serving. Instead, use whole foods and stay away from like the highly processed packaged foods. What you will find is if you can change and clean things up, a 16% reduction in diabetes risk is seen for every kilogram of weight loss, which is extremely impressive. Another interesting factor, especially in pre-diabetics, by making weight loss changes by cleaning the diet, the complications that come from blood vessel disease like the heart attack and stroke reduces significantly. As far as exercise goes, the American Diabetes Association recommends at least 150 minutes of moderate intensity physical activity 3 times a week. And in fact, a research study, a meta-analysis of 14 studies showed a significant reduction in hemoglobin A1C in individuals who performed moderate to high intensity exercise. So there's a lot of evidence that shows the risk of developing diabetes can be lowered by just participating in moderate aerobic exercise. Now, regular physical activity combined with diet modification, not only will it make you lose weight and reduce your body mass index, it increases good cholesterol, like your HDL. It lowers bad cholesterol, like your triglycerides, and it helps to normalize blood pressure. So I cannot emphasize enough the importance of habitual physical activity because it can reduce death from all causes, basically by reducing your risk of heart disease, stroke, and even colon cancer. Another great thing about physical activity, it reduces the inflammation in the body, like which I told you before, plays a huge role in how your blood vessels are affected. So individuals with prediabetes due to insulin resistance, now this too can be reversed by being a habitual physical exerciser. So excess fat, which is usually around the waistline, is what contributes to insulin resistance. And regular exercise has been shown to reduce the body fat and increase cellular insulin sensitivity. In fact, the glucose uptake, it remains elevated for up to 120 minutes after physical activity because it increases a type of transporter called glucose transporter type 4, which helps your tissues to utilize insulin the right way. And this insulin sensitivity can last for up to 16 hours after exercise, which is pretty amazing. And this positive attribute of exercise is seen both in individuals who don't have prediabetes as well as in those who do have prediabetes or diabetes. And on top of that, it helps with fat metabolism, which is a big problem in individuals with prediabetes. And what we found is a single amount of moderate intensity exercise can increase your glucose uptake by at least 40%. All of these are pointing to the fact that physical activity is crucial and cannot be ignored. In fact, in a Cochrane review by Hemmingsen, who looked at 12 randomized controlled trials, there were around 5,238 individuals. It was noted that diet plus physical activity reduced or delayed progression to type 2 diabetes in those who already had the diagnosis of prediabetes. So moving on, I'd like to touch a little bit about intermittent fasting. Intermittent fasting is amazing, and I personally have found the benefits of intermittent fasting. What is intermittent fasting? It's basically an eating plan in which an individual has designated eating and fasting periods. Now, these periods can range from 16 hours to even several days. So fasting is basically defined as abstaining from all calories. Therefore, when an individual is fasting, they will only consume water or coffee or maybe even some tea. But people who engage in fasting have found numerous benefits, and that includes mental clarity, heart health, memory, and just overall sense of well-being. So the intermittent fasting has been found to be very effective in individuals who have prediabetes. And this was also published in the Johns Hopkins Medical Journal in 2020. Some of the mechanisms in how intermittent fasting benefits individuals with prediabetes, for one, it increases insulin sensitivity, basically by working on the cells that make insulin, which are your beta cells in your pancreas. So there are many regulator proteins that play a role in how your beta cells secrete the insulin and function. And intermittent fasting actually positively helps these proteins to be manifested or stimulated, and which in turn helps the beta cells in your pancreas to produce more insulin and function in a way that is beneficial in metabolizing the excess sugar in the blood. Another great thing that intermittent fasting does is it reduces the fat cells in the liver, which is also very dangerous. Another thing to also mention is a coding protein called TFEB. Now, what that is the TFEB is a type of protein that regulates what we call autophagic flux in the pancreas. The autophagic flux, what it does is it cleans out all malfunctioning mitochondria and harmful white fat cells, which a lot of people with prediabetes and diabetes tend to have. So overall, it's called the autophagy lysosome pathway. And this is what contributes to the insulin producing cells in your pancreas to survive. And it actually helps a lot with managing that type of metabolic dysfunction that we find in prediabetics and diabetics. Another great thing about intermittent fasting that was found was it decreases a substance called triacylglycerol levels in the liver and pancreas. And this in turn stimulates your beta cells to function well. I do want to mention there was one particular study that looked at diagnosed diabetics who were already on insulin and oral medication. And what they did was 24 hours of fasting 3 times a week. And these individuals were actually able to safely wean off their insulin. And some of them were even able to completely stop their oral medications, which is very, very impressive. Obviously, you don't want to do this on your own. It has to be done under the supervision of your physician. Anyway, in conclusion, the point I would hope you will all take home is that prediabetes needs to be taken seriously. If not treated properly, prediabetes can result in serious complications such as heart disease, nerve problems, kidney failure. Intentionally making lifestyle changes can help those with prediabetes reverse the harmful effects of this condition. It is never too late to opt for lifestyle choices. If you are South Asian or have a family history of heart disease, please make sure that you do get screened. And as always, reach out, ask questions. I will also be very happy to assist you in your health and wellness journey. Until next time.